Dear students, in this video we are going to discuss about renal stones. So a renal stone is also known as kidney stone or renal calculus or nephrolith. So these are all the other names of kidney stone. So kidney stone is a solid piece of material which is formed in the kidneys from minerals which present in the urine. Kidney stones or calculi develops as a result of various metabolic disorders which affect the fate of calcium and other mineral elements present in the body. Stones may be formed in various parts of the renal system. So the stone may be formed in the kidney, urinary bladder, ureter or urethra. So there are various regions of stones may be formed in the renal system. And then next one is causes of renal stones. So the first main cause of renal stone is diet, that is vitamin A deficiency, hypercalcemia, hypercalciuria. When the calcium level is increased in the blood, obviously the calcium are excreted in the urine. So hypercalcemia and then excess amount of calcium are excreted in the urine. So such condition is hypercalciuria. And then next one is excessive intake of vitamin D. And then next one of the causes chronic dehydration. So chronic dehydration is also major cause of renal stone. And then next one is hyperuricemia. When the uric acid level is elevated in the blood, obviously that disease condition is called as gout. So gout is also one of the major cause of renal stones. And then next one is chronic urinary tract infection. So chronic urinary tract infection is also the one of the causes of renal stones. And then next one is inhibitors of stone formation. Stones can form when there is a deficiency of substance that normally prevent crystallization in the urine, such as citrate, magnesium and nephrocalcin. So nephrocalcin is one of the protein which inhibit the stone formation. And then next one is types of renal stones. So there are various types of renal stones, but they are mainly comes under 5 types of renal stones. So first one is calcium oxalate stone, calcium phosphate stone, styrivate stone, uric acid stone and cystine stones. So these are all the 5 major types of stones. So and then next one is calcium oxalate stone. So calcium oxalate stones are most common substance and found up to 90% of renal stone. So calcium oxalate stone is also known as mulberry stone. So these kind of stones are more common in men between the age of 20 to 30. That is between the age of 20 to 30 years, the men are prone to this kind of calcium oxalate stone. And then when the calcium combines with other substances such as oxalate, phosphate or carbonate to form a renal stone. This kind of stone is very hard, brown in color, covered with sharp projections. Then next type of stone is calcium phosphate stone. So calcium phosphate stones are caused by the supersaturation of urine with calcium phosphate. So these kind of stones are formed in the alkaline urine condition. So the calcium phosphate stones, when the urine condition is alkaline, when the urine pH is alkaline, means these kind of stones may be formed. And then next type of stone is styrivate stone. So this styrivate stone is mostly prone to women compared to men. So styrivate stones are most foundly in women who's having chronic urinary tract infection. So urinary tract infection is one of the causes for styrivate stone. So it is caused by urea spitting bacteria, that is some of the microorganisms such as Proteus, Pseudomonas Klebsiella, and Staphylococcus. So these are all the pathogens. Pathogens means that is disease causing microorganisms are comes under pathogens, especially Proteus, Pseudomonas, Klebsiella, and Staphylococcus. So these are all the major causes of Sturivate stones. And then next one is these stones can grow very large and block the kidney, ureter, or urinary bladder. So these stones are very large compared to calcium phosphate and then calcium oxalate stones. And the third type of stone is uric acid stone. So uric acid stones are more common in men. So it is caused by excessive dietary purine. So excessive dietary purine intake, obviously uric acid stones are formed when the purines are degraded into uric acid. So when the dietary intake of purine is high, obviously the uric acid is also elevated. So uric acid is one of the major cause of this uric acid stone. So these type of stones are formed in acidic condition. And then last type of stone is cystine stone. So cystine stones can form people who's having cystinuria. So cystinuria is one of the inborn error. So cystines are excreted in the urine. So that condition is called as cystinuria. So this disorder runs in family and affect both men and women. So this kind of stone is a familial diseases, familial renal stone diseases, and then this kind of stone may be affect the both men and women. So it is caused by cystine crystal formation. So the crystals are formed, cystine crystals are formed in the it may be in the ureter, bladder, or urea. So cystine stones tend to form in acidic urine condition. So these kind of stones are formed during the acidic urine. And then next one is signs and symptoms of renal stone. The pain symptom is the main symptom is severe pain that starts suddenly and may go suddenly. The renal colic pain, hematuria. Hematuria means that is when the blood is excreted along with the urine. So that condition is called as hematuria. Chills, fever, nausea means vomiting sensation, and also vomiting. So these are all the major symptoms of renal stones. And then next one is, that is last one is treatment. High fluid intake and alkalize the urine, dissolve most of the smaller cystine stones. So high fluid intake is the one of the major treatment for renal stones. So it dissolves the stone and then excreted in the urine. And also administration of D-penicillamine. So D-penicillamine is one of the antibiotic which binds to the cystine. Then the urine is that is soluble in urine. The cystine is insoluble in urine. When administration of D-penicillamine antibiotic combines with cystine, when the cystine is excreted in the urine. And then next one is large obstructive stone. So surgery is needed for the renal. So surgery is needed to remove the larger obstructive stone. Thank you.